Good morning, everyone. Really nice to see people. And I'm very pleased to say that today we've got Dr. Jennifer Crawley, who is an NHS dermatologist, and you're a consultant for both children and adults. That's correct, isn't it, Jennifer?
That's correct, Katrina. Yes, I do both adult and pediatric dermatology.
That's it. And so I just want to do a quick shout out to Child's Farm, who have very kindly sponsored this event. And you might also all see that we are running an offer of Child's Farm. So if you do go over to win some of the, I think it's a bundle of products. So please go look at our offers to have a look at those. But I just want to stress that Jennifer is independent, although she does advise and support Child's Farm. She is actually an independent NHS advisor. So, Jennifer, what we're going to talk today is about skin conditions, and in particular, look at one that is most prevalent for children with skin issues, which is eczema. And in fact, it is why Talk Health was founded so long ago, because it was based on the problems of trying to find independent advice that you could trust on the internet. And we all know that's a big problem. And we also know that it's one of the biggest problems for parents with small children. I mean, luckily my children didn't have eczema, but all I can think is what a nightmare for parents when you can't explain to a baby not to itch. I think, for want of a better word. So yeah.
I know, Katrina. Well, eczema is really so common in babies and toddlers. So that's the first thing to say. And I suppose to reassure parents that, they're not alone. And, it is a very common skin condition. About 1 in 5 children less than 5 years of age actually have and experience signs and symptoms of eczema. I suppose, my first role when I meet any new parent, who is sent to my clinic is just to try and reassure them, that they're not alone and we can improve things, and we can, there are lots we can do for children with eczema. Now, to say that the majority will grow out of eczema, after the age of 5, and which is obviously a very positive message, to say it. But babies, Katrina, and toddlers are so prone to eczema because it takes, obviously our skin is a very good barrier. So our skin is so important for lots of things. So it's important for temperature regulation. It's important to keep infection out. It's important to manage our electrolytes, our minerals, etc. And as I say, very important for temperature. And when you are a baby, Katrina, it takes a little while for your skin barrier to fully form. So it can take 12 months at least. And that's why babies and, toddlers are so prone to eczema, because it takes a while for their skin to mature. It's much thinner than adults, and the building blocks of our lovely skin is a little bit loose, the cells and the building blocks, hence skin can dry out much more easily, and skin can become a little bit red, a little bit inflamed, a little bit angry in certain areas, and as I say, that's why things improve as babies and children get older. I suppose the first thing to say that is so important when children's skin is sensitive or prone to a little bit of eczema is moisturizing is the key, just to help restore that skin barrier, Katrina, and to help, from an external environmental point of view, just to keep skin really well hydrated. And lots of moisturizer, as I say, acts as a good barrier, to infection and to dry. And that's the first port of call for parents. And I suppose, like everything I always say but to children in my clinic, a bit like brushing your teeth, it's always good to get into a habit, of moisturizing your skin. Good for children and adults, to be fair, Katrina. So just get into the habit of that every day. It's a good life skill to continue with.
So if we take a step back, I mean, I suppose there's two things that I want to, because, especially if it's your first child, well, I don't know whether it's your first child, or you suddenly notice that you think a child's skin's not right. is the first port of call, would you suggest to go to see your GP, or would you suggest using sort of creams? And I suppose dependent on the age of whether it's a baby and a child, because clearly there's a difference because, as you said, of the development of the epidermis.
Yes, so definitely, Katrina, if the skin looks a little bit dry, so if there's not a lot of inflammation there, so the skin doesn't look red, if there doesn't look to be any infection on the skin, so, there isn't any yellow crusting, for example, if the skin just looks dry, a good starting point, Katrina, is a really good moisturizer. And obviously you want to make sure that your moisturizer, doesn't contain any nasties like parabens, it's not heavily fragranced, you want to avoid SLS, etc. So these ingredients and components can irritate skin in adults, but especially in children. So you just make sure you're using something for babies, for children's skin, that doesn't, as I say, not lots of fragrance, not lots of perfumes, parabens, avoid SLS, and just get into the habit of moisturizing at least twice a day.
So regardless, you should moisturize the babies. I mean, you moisturize their bottoms, don't you, to start with? Yes,
you do. Now, we say, Katrina, in newborn, so for the first 6 to 8 weeks, you shouldn't need a lot of moisturizer, and you should try and, because babies are born with a certain covering on their skin called the vernix, and that adds natural moisture to a very, a newborn baby's skin. So we say,
what's that? Is that the hairy bit?
No, it's like a thick coating, that be like a little sack, Katrina, that baby born with, and it's called the vernix, and it's actually a white coating, and it is left and just absorbs into baby skin and acts as a super natural moisturizer. So that's why, for those early weeks, they have their own natural moisturizer with the vernix. So once the vernix starts to absorb into the skin, as the weeks pass, then that's the start using something external on the skin. And I always say as well, Katrina, obviously, I know parents, will be very aware, but if parents are doing lots of moisturizing, but you're finding, Katrina, that the skin is red or inflamed or appears itchy or irritated, obviously that's the time, to see the health visitor or, the GP, if the skin looks red and inflamed and a bit irritable.
And so with very small babies and nappy rash, it seems, well, it was a long time ago, I had children, and it's hard to remember. And I kind of also remember when you have one baby, you have your next baby, and it's like starting anew. You kind of sort of forgotten everything. But I suppose it's just making sure everything, particularly around, because of urine and stinging, making sure it's fully moisturized down there all the time, so it doesn't, the ammonium, I suppose it is, it doesn't break through.
Quite correct. Because urine and can act as an irritant on the skin, very irritating on the skin, as you say. So that's why it's important to change nappies very regularly. Important to make sure you're getting a little bit of gauze or cotton wool just to clean those areas, and make sure you're cleaning within the creases as well, Katrina, to remove any irritants that can linger there. And then use a really good moisturizer as a good barrier to those irritant elements as well, and obviously any little bacteria or little fungal rashes, Katrina, love a warm, moist environment. They thrive in that area, and obviously the little nappy area is so prone to infection, Katrina, because those are the perfect conditions for bacteria and fungi to multiply. So that's why making sure the area is cleaned regularly, as I say, within the little skin creases, and then a good barrier to act to keep all those irritant nasties from urine, etc., away from close contact with the skin.
So with babies, I mean, for me, just remembering, and please, tell me, so the main things are when you're looking, I just remember looking after the bottoms and also cradle, when they start, whatever is it called, cradle napple? I can't remember what it's called now.
Yes, cradle cap. Yes. So again, most babies, Katrina, will have cradle cap. It is So common. And it can present in different ways. It can present as white, dry scale or flakes on the scalp. And sometimes it can look rather yellow, and some babies and toddlers can have a lot of it. And again, normal, just to reassure parents, that will settle. That is normal in this age group, and there's nothing wrong, with your baby. But again, just important to keep that area really well moisturized, Katrina. And even if you find that there's lots of thick scale there, sometimes just using your moisturizer and leaving it on for a little bit. And if there is lots of thick scale, just very gently with a little flannel, just trying to very gently put a little bit of traction on those scales to remove them from the scalp. If there is any, looks a wee bit infected, Katrina. So if there's lots of thick scale, it's a bit irritated, a bit red, sometimes a little bit of steroid with a little bit of anti-yeast or antifungal in it can be helpful. But obviously that's, prescribed by GPs, etc. The minority of babies need that. The majority of babies, as I say, cradle cap is so common, and good moisturizing regime just to remove that waxy layer is all that is needed.
And so when you I was sort of thinking bathing babies, so there's two things. Is would you recommend putting a sort of a bath moisturizer into the water, and then would you use the same for the I don't think with babies you use separate shampoo, do you? Or do you, depending on their skin?
Yes, no, normally, Katrina. So again, for those first few weeks of life, we only suggest using water for bathing. But again, making sure that, for those early newborn, making sure again that you're just getting a little bit of cotton wool and just cleaning all the creases, etc. And as babies get a little bit older, then bathing every day is absolutely fine. And we, from a dermatology point of view, we recommend that, as long as, Katrina, there's something nice and oily and hydrating and moisturizing in the bath water. Because water by itself, as babies get older, can dry the skin out a little bit if it's used by itself. So you're adding something nice and oily and hydrating into the bath for washing, and again, like you say, washing and using on the scalp is perfect.
Okay. And so we have a really lovely lady, a nurse called Julie Van Olsen, and I remember I think it was her who said, when you're thinking about how hot your shower should be, she said, would you put a baby into your shower or into your bath? And then if the answer is no, then the water's too hot, which is interesting. So, and I kind of never thought about it, because I'm sure as we get older and older, we get it hotter and hotter. Although, obviously, the latest fad is to have a cold shower, but
I know, cold showers, cold water swimming, Katrina, that's all the rage. No, you just want the water for adults and, obviously children to be tepid. Just tepid, because if it's too hot, in adults and children, Katrina, it can be much too irritating to the skin.
So that's it. So be obviously very gentle. I'm surprised that you say about having as long as it's only softly scented, as opposed, because a lot of people say to have no scent. And do you think some products are okay with scent in them?
In older children, Katrina, so again, not newborns, not but in older children, a little bit of scent is absolutely fine. Newborns, we keep it all very bland. So newborn little babies, no scent at all. As children get a little bit older, a little bit of scent is fine. As I say, so I know I'm repeating myself, as long as you're avoiding SLS and parabens.
Okay. And what sort of age do people start presenting, apart from obviously the normal sort of nappy rash or the cradle cap that we mentioned? When do they start presenting with skin problems, and also what is the most common skin problem?
So I suppose, there are a few skin rashes that we see, in babies and newborns. So obviously eczema, very common, or just dryness of the skin. So we say cradle cap, a little bit of baby acne, nappy rash. They're the most common types of things. As I say, most of them are very easily managed at home, with the help of the health visitor, district nurse, GP. And then I suppose as far as GPs or secondary care goes, it's mainly, those children with eczema that we would see.
It is, yeah.
It is, and we also see in that something that's not uncommon in that age group are little skin infections as well. So children, especially if they are prone to a bit of dryness or eczema, that can manifest, as we've said already, with different skin infections. But children can also present with little viral warts on their skin or little areas of impetigo, which are just very localized small areas where the skin is infected with a little bit of bacteria, a little bit of staphylococcus aureus. But again, all very manageable, very treatable with topical treatments, but obviously important to get advice if you think that is a problem.
And so when do you start being a consultant? So we're talking secondary care. So once
Yes.
you've been to the GP, what are the factors that make a GP refer people on to someone like yourself, Jennifer?
So it would be if, GPs are so well versed, they are brilliant at managing, these types of dermatoses in their practice. Absolutely. However, if GPs are doing all of the right treatments, but skin is progressing or failing to respond, then we would be asked for an opinion. And if children's eczema is the more moderate, range or moderate to severe rather than just mild, we would be asked to see if they're treating nappy rash or skin infections and they're not getting better. Sometimes we'd be asked for a second opinion, just to be sure it is, what everyone thinks it is, that the diagnosis is correct. And obviously we will escalate treatment quite quickly in order to improve, the signs and symptoms.
And what would that treatment pathway be?
Do you mean for eczema?
Yeah, well, I mean, if we take eczema as
Sure.
as one of the most common reasons, yeah,
absolutely. So normally when GPs refer children to us, obviously they've started really good management. So they're using soap substitutes, lots of moisturizers, and perhaps they're using a mild topical steroid on the skin when they flare. So I obviously will reassess the skin, just find out what, parents are using on the skin, symptoms are, duration, what's helping, what's not, what are the triggers, etc. And then I will obviously want to escalate management a little bit by, increasing the strength of topical steroid, seeing if there's any secondary or superimposed infection that we need to treat, just trying to work out a little bit about triggers, whether food allergies playing a role, whether I need to get this, child to see my pediatric allergy colleagues, and just to try and get a good longer term, but importantly, Katrina, preventative regime going. Because it's fine to treat symptoms when they flare, but then remember, eczema is one of those frustrating things that just kind of does this and will come back again. So it's trying to get a good management plan, a good preventative or maintenance treatment plan, and then make sure parents, know what to do if things start to escalate or flare a little bit more than they should.
So out of that, three things that came to mind: triggers, management, but you mentioned the word steroids. Now, there's lots of, people are very anti steroids in many ways, and we've covered that quite often, and it's something that's a hot topic in many ways. And it'd be interesting for you to say, because normally we talk about the issues of steroid treatment in adults, but within children, what are, I suppose, is it managing it carefully, or how do
So I suppose, it's with the majority of parents who come, to clinic, we always, there is always concern about using topical steroids, which I totally understand, and I hope to try and reassure parents accordingly. Obviously, there are a huge spectrum, Katrina, of mild, moderate to severe potency steroid. Adults use the more kind of moderate to potent end of the spectrum. Obviously for children, less so. And we all follow our guidelines, NICE guidelines, British Association of Dermatology guidelines, British Society of Pediatric Dermatology. So we've lots of evidence-based guidelines that we all follow. And as long as parents are using doses, quantities as advised, and by that I mean, for the number of days, the correct strength, not, using correct quantities, then it's to reassure parents that is absolutely fine to do. And quite often, Rena, using a lower strength steroid or not at all is more detrimental to children because their eczema gets worse and worse. And then you use something stronger for a longer period of time. So it's important, under treating eczema is not a good thing. And that's why it's important to be proactive in order to get on top of, symptoms and signs and try and settle those down, as quickly as we can. And as long as parents are using steroid as advised, as I say, with dosing quantities, then they won't run into any problem.
I think because we've done obviously quite a lot of work in dermatology, the biggest surprise is people don't realise how much they're meant to be using. And I think people put on, like you said, less possible. What you didn't say that, but because you're saying if you're not treating it in the way you should. So if people think, well, I'll just put a little less on, then that's almost detrimental because it's not sorting it out when you really need to get on top of it.
Absolutely. And if you don't, I say this time and time again, if you don't treat adequately, things just get worse and worse. And as I say, so I know I'm repeating myself, you end up using perhaps a higher strength topical steroid for a longer period of time. So that's settle down that acute flare. And then we have topical treatments that are steroid free. That we use for preventative or maintenance treatment, so that are great for children, great on the head and neck area as well as the body. So it's important for me that, as I say, we settle down that acute flare, and it's miserable for children having red, sensitive, itchy, sore skin. So we try and settle that down, as I say, with our, right dosing, right quantity, right strength of topical steroid. And then hopefully, once things improve, we can move on to a steroid-free preventative or maintenance regime.
And I suppose the other thing that is very important is how you apply it. So it's, as I remember being taught, is where you brush up, don't you? Is that the same with babies and children, or is that just adults?
Same. So we always say when using even any moisturizers, it's important that you don't rub the skin up and down because that just makes things worse. It's important for a start when you're drying babies and children's skin. Again, you don't rub dry, you just pat very gently, with a clean flannel, clean towel, just pat skin very gently rather than rubbing to cause any friction. And then important that you use your moisturizer in a dark application. So starting, say, at the top and just, one stroke down and in the same direction rather than rubbing the skin. So that's so important.
And so is it down or is it up? Or does it matter?
It's down. So it's in the down.
And I'm going up.
Oh yes, so it's in a downward direction.
Downward. Yeah. Okay, so it's going down in a sort of soothing way. So, and then obviously going on to, once you've got it, I'm a great believer in understanding how to manage the situation, because if you know that you're going into a flare-up, if you know how to manage it, you don't need to necessarily go to a doctor's. And I think that's something that everyone, from the GPs I've spoken to, is about trying to get people to say, don't panic. You will, flares do happen. It's nobody's fault. They just happen. And get to know what for your child is the way to manage it. And then you can go straight into that management treatment.
Yes. So most definitely, Katrina, and the main thing is just education. And it's educating in life in general, but especially in dermatology and especially in pediatric dermatology, is just educating parents, just giving that advice, like you say. Eczema, frustratingly, as I say, and as we've already discussed, will flare up and down. So it's just trying to make sure we have a management plan, that everyone, parents, GPs, etc., we're all aware of, that we can instigate when things flare, because they will. There is no doubt, they will. And it's just trying to start that treatment on time, in a timely manner, just to settle symptoms down. And as long as everyone's educated, and aware and has that knowledge, then it's much less concerning and worrisome. So you're absolutely correct.
And is there a standard management sort of routine that you would advise to people?
Every child is very different. So there are lots of factors that feed into that, and that's why it's so important that obviously we see and advise children individually. Very generally, the mainstay of treatment is going to be using, something in the bath, like we've already discussed, moisturizing every day, keeping children's skin cool, not overheating, using light cotton fabrics, for example. So lots of those, very practical things can be helpful. But as far as a management plan goes, then, children, every child is different in that regard.
So, and you mentioned triggers. What are the most common triggers that you see?
So, first of all, little irritants to the skin, again, like we've already discussed. So, obviously in the nappy area, urine, etc., can be into the skin, using some types of very perfume, fragrance, soaps, chemicals, those types of things. Lots and lots, overheating the skin. As children get a little bit older, pollen, grass, sometimes animal hair. These are all irritants of the skin in general. And obviously children are prone, or their skin barriers, we say, or the epidermis is much thinner. They're more prone to those triggers being more problematic.
So, and you said also you then send people, when you're looking to diagnose and work out the best course of treatment, about sending them off to an allergist, you said? Or...
Yes, a pediatric allergist. That is not common. And I think there's a lot of, that's a whole kind of different discussion in itself, but food allergy does play a role in some children's eczema. I think sometimes people are worried that is what's causing it. And, that in the majority of children, that is not the case. Again, just to reassure parents. And food allergy only really plays a role when there's a very strong history, Katrina. So children are exposed to a certain foodstuff and their eczema flares widespread, very quickly. Food allergy is not a common cause of eczema, but it is something that we do see in some children, especially those children from what we call atopic backgrounds, where maybe parents have, quite difficult eczema, hay fever, asthma, etc. But that is not common, and most definitely that if people think that is what is flaring things, then secondary care advice is needed for those children.
And is eczema hereditary?
So it's not hereditary per se, so you don't pass it, from mummy or daddy, to child, but it does run in families. So there are children, who are going to be genetically predisposed to be of developing eczema. So eczema is a very complex condition. You obviously have that genetic component, where you're susceptible to it, and then lots of those environmental factors feed into that as well. Eczema is part of, those atopic conditions, which also involve asthma and hay fever. So quite often they, will run side by side. And
so actually, that's an interesting point. Does one come before the other?
No, not necessarily. Obviously, asthma again is very complex, and normally children are a little bit older when they are diagnosed with asthma. So that is not, a diagnosis that is given to a newborn, certainly, or a young child. So perhaps skin manifestations, eczematous change may precede the asthma, but again, conditions, do tend to occur together and run in families as well.
Mm. And I know that a lot of people have, advocate that you have the same type. So if you're using Child's Farm, for example, you look at the range. Would you agree to that? It's good to look at a range of products as opposed to individual brands.
Yeah, range of products is helpful, and obviously, what works for one child from a moisturizing point of view, what they tolerate, even in adults, varies so much. So I always try out a few things, and certainly in our pediatric population as well, some emollients will work best for some children, and etc. And remember, there are different formulations which are important. So you have the more lighter lotions going through to a cream-based, and if children are very dry, obviously an ointment-based emollient is better. So the formulation is important as well. And for example, in adults, we will use thicker creams and ointments in autumn and winter when our skin dries out a lot more. Spring, summer, you can use something a wee bit lighter, more cream-based. So again, the formulation is important, as well.
And then, I mean, as I understand it, the weather can absolutely play a big, is certainly a trigger point. So if we're going into when it's something that looks like it's getting colder weather, that when I think you'd expect the eczema to potentially get worse, would you advise that you start preparing the skin, you go into a stronger, emollient moisturizer before it even starts?
So absolutely, eczema flares in autumn and winter, most definitely. Some people will get a bit of a flare in spring, summer, just because of pollen and grass can irritate the skin. But the majority of people, Katrina, autumn, winter, so, colder weather, central heating, going, from extremes of hot and cold, can, especially, in children and babies, just dry the skin out so much. And again, so important. I know even in my own skincare, my autumn winter regime is a wee bit different to spring and summer. You start to use something a bit more moisturizing, a bit more hydrating, a little bit thicker. So absolutely, like everything in life, treating everything in medicine, prevention is the best thing. So you're quite preparing your skin, being aware, increasing the number of applications, of children's emollient as we come into autumn and winter, and using, as I say, something a wee bit thicker is so important in order to try and help prevent eczema flaring.
So would you say that's one of the biggest things, is to do there's management and prevention before you have to really get into full scale stuff is really a wise thing to do?
Very wise, very wise. And it's something, whenever you have a flare of eczema and it settles down, per parents, I always feel really bad, saying you need to keep this going twice a day because everyone's busy, and if you've a few children, it's hard to put these different creams on all of the time. But it just really is so important, and just, as I say, tries to prevent these flares, and is just crucial in the overall management of dry skin and certainly of eczema.
I mean, I feel so sorry when I hear about people, their children are absolutely screaming in the night and itching. And I know that we've done quite a lot of products of, mitts and things like that, which, obviously really helpful, aren't they?
They are.
Use. But the emotional stuff side of it must be really, really hard.
And it's not just that poor little child, it affects the whole family, and parents, if they're, up in the night, and it's so distressing to see your child itchy, uncomfortable, not sleeping. In older children, it can go on to affect concentration and schooling. So really, it just affects everyone, and it's awful whenever you see families in that situation and you're just desperate to help and get this eczema under control. And, as I say, it just affects everyone within the family. Absolutely.
Well, I know that, well, I think, was it that the schools will not apply eczema cream onto a child now? Is that right? Or,
Yeah.
what do you do?
So again, it's very difficult to, years ago, that wasn't a problem. And, creams were being, put on at school, but of recent times, and especially with COVID as well, sadly that is not happening. Now, some schools, some children, they may have a school nurse and etc. who will help with that, but it's more common, that doesn't happen. And, the only thing for these poor children is, to give them their own little pot of cream in their school bag. And, I'll talk to them, parents will talk to them about, using their cream at school if they can. But then that means it's even more crucial to try before school and, coming home from school and bedtime, just to make sure at home, children are at least getting moisturizers, etc. on their skin, then. But it is, yes, it is a problem.
Yeah, I just think it's very sad, isn't it? Mm-hmm. It's very, very sad. A really stupid question that I think I know the answer, but it's like, what is the difference between an emollient and a moisturizer?
So again, when you do use those terms interchangeably, and obviously a moisturizer is something that, perhaps isn't necessarily as thick as an emollient, but we use those terms interchangeably.
Yeah, so it is really one and the same.
It is, yes.
And it is. I know that a lot of emollients have come off formulary, i.e. GPs now can't prescribe a lot of things, and you have to go to your pharmacist to get it. I mean, what do you think about that? Is that a problem, or?
It can be a problem, and certainly for me, the main thing is getting in a child, with very difficult eczema, just enough quantity prescribed. A big 500 gram. So it's really the quantity. So yes, so that is difficult. But obviously, I am aware of resource, Katrina. I am aware of the current climate in secondary care, primary care. Everything is a balance, but getting quantities, enough quantities to treat pediatric eczema, can be difficult. But it's difficult for parents, difficult for primary care, difficult for GPs, and I suppose we're all very aware of resources, etc. But I suppose as far as emollients and moisturizers go, I always prescribe big quantities.
Yeah, and don't be stingy when you use it. And also prescriptions are free for children as well.
Yes, they are.
So, okay, so I mean, I know we're really talking about eczema, and I'd like to go on to other things in a minute, but so generally with eczema, do you have a sort of peak age and then it peters off, or?
So we it for those reasons with regards to skin barrier and thin epidermal layer, etc., in kind of 5 years and less, so up to the age of 5 years, and then after that, you find that symptoms improve, significantly. Those children who will carry eczema into adult life, as I say, have perhaps a strong family history or other atopic type conditions as well. But things we do see a little cluster, up until the age of 5 years.
Okay, and then hopefully, and then as you said, a lot of people, is it, would you say the majority of people grow out of eczema?
They do, yes, they do.
But is it something that you might have had it as a child, you become a teenager, you then probably go into another set of, the typical acne issues, for example.
Yes.
And then can you go back into getting adult eczema? And do people get adult eczema?
Yes, you can have eczema, as a child, and then it can unfortunately manifest or flare again, as in adulthood. And we do see quite a lot of eczema, as you advance in years as well, because
oh, really?
as you get older, our skin becomes thinner. You lose colour, elastin in the skin becomes thinner. And once again, prone to drying out and eczema. So there are definitely those peaks. And again, if you've been prone to eczema as a child, then that can manifest a bit later on in life.
Gosh, and what sort of age? Is there a specific age, or?
It's very variable. Very variable.
But would you get eczema if you hadn't had eczema as a child? Could you have it as an adult?
Yes, you can do.
You can.
Yeah. Sometimes triggers cause that, and other environmental factors, come into play. When you're older, Trina, obviously eczema is an umbrella term. There are actually lots of different subtypes. You can eczema and irritant eczema and allergic eczema, kind of hand and foot eczema. So there are lots of different subtypes, and some of those you see more commonly in adulthood.
With I've seen, and we certainly support people that have hand eczema, which I just think is a dreadful thing. People just say, well, I think the problem with eczema is everyone said, oh, well, I've just got a bit of eczema, and it's sort of poo-pooed without actually realizing how devastating eczema can be when you have severe atopic dermatitis, for example. It is life changing in so many things. But with hand eczema, which I've seen, and like people who haven't understood about hand eczema, it actually, people can't dress themselves, they can't go to work, they can't use their hands, they're always covered in sores. I just found it shocking, and then people just go, oh, well, it's just eczema, and you think, oh, for goodness sake. Do children have hand eczema as well, or is it just more a sort of standard, I don't know, whatever standard eczema is, but
normally in children, eczema occurs very much at what we call the flexural sites. So it will occur in the little skin creases, so inside behind the knee, the wrists, the neck, the little folds. But definitely children can be very prone to, dryness, of the fingers, especially if they're using or playing and their maybe hands are in water or, in sand, or, they're playing, and all of this feeds and adds as an irritant. And again, that can be quite difficult to treat, only because that area is so exposed, and you put on your treatments, your creams, and then they're in the mouth or they come off, etc. But I suppose, as a dermatologist in general, I think, I suppose a lot of, seeing a wide variety of skin conditions, obviously every day, and doing skin surgery, and, in adults, obviously seeing a lot of skin cancers and a lot of inflammatory conditions. I suppose when I do this job, some people think, oh, it's only skin, and it's not life-threatening. And I just think, oh my gosh, severe acne, severe eczema, psoriasis, other inflammatory conditions impact that person's life all day. And it is something that it just impacts quality of life for the patient, the family members. And I suppose there are lots of good treatments that we have, and people don't, lots of good things we can do as dermatologists, and GPs can do as well. And I suppose the one message is, people don't have to kind of live with that or put up with that. We do have treatments that can hopefully help the majority of people, no matter what their skin problem is.
And have there been, I suppose one of the things that I know when you're treating skin is one product may work for a while and then just suddenly it stops. And so it is a continual, I think it's important to understand that you have to keep going back to your GP. And I think if you're not happy with your GP, one thing that I always say to people is that go and find out if you've got a gypsy, a GP who specialises in dermatology is always a really good start.
Yes.
And don't be embarrassed if you get fobbed off. by them saying, oh no, that's the only thing we've got. And because you're saying there are so many alternatives, is to keep going back and go and talk to another GP if you're not happy with the one you've got, to go and get someone to support you.
Yes, I think, skin disease is so common, and, we do have good treatments, and GPs, are overwhelmed. They have to know so much about everything.
I know.
Very aware, as a dermatologist, this is our specialty, etc. But, I suppose definitely you're right. There are lots of different treatments. There are lots of things we can do. And if treatment is not working or not helping, then it's so important, to seek an alternative therapy or treatment plan, because people don't have to live with pearly skin.
And apart from eczema, what are the other things that you see? What other things present for children with their skin?
For children, so obviously in those newborns, like we said, cradle cap, a little bit of baby acne, skin infections, eczema. They're the most common things. We see something totally different that's not an inflammatory thing, but obviously in children, I see children who present with some birthmarks, who present with little vascular lesions on their skin, so something called little strawberry hemangiomas, or little strawberry marks are very common, Katrina, but benign in children. So they're the other things that we see. You see kind of the inflammatory rash type dermatoses, as I say, like our eczema, etc. And then you see lots of birthmarks and little vascular, little blood vessel vascular lesions on babies as well.
It's just as we get older that we get all the problems and the wrinkles. I think that's
so your sunscreen is so important to prevent those wrinkles and pigmentation, and to prevent skin cancers. And
one of the things, so we had Dr. George Moncrief on the other week, and he's an advocate for how important sun is for us, for our health all over. And he said that obviously one of the side effects is that you get wrinkly being out in the sun, but it didn't bother him. Whereas I think, without trying to be sexist or anything, as a woman, you're thinking, oh, that is a bit of a problem, the wrinkles. But the thing that he was very, very clear on is that children should not present into the sun until at least 11. You should keep them covered up. He was very, very strong on that point. Absolutely,
because that is something, again, that Child's Farm do very well, that whole baby and children's sunscreen range. And it's so important to protect babies and children's skin from the harmful UV rays. We do know, in adults with our skin cancer work, that, those patients who have had a lot of sun exposure as a child and a teenager, lots of burning, blistering sunburns, high risk for development potentially of skin cancer at a later stage in life. So important. Obviously for newborns and small babies, you absolutely keep them out of the sun completely. Older people want to go out and play in the park, we want to go swimming, but it's so important to use an SPF 50, a hat, cover up with a little rash vest, make sure you're protecting kind of their eyes with sun, and that is so crucial.
And I think also, I'm absolutely convinced the sun has got harder, stronger since I was young, and you just feel it burns so much quicker now than it ever used to.
Yes, no, absolutely. And it just, yes, there are lots of things we can treat in dermatology, thank goodness, that we have great treatments, but obviously some, malignant melanoma, that skin cancer is something that, can be very, very, very dangerous, and we want to avoid that at all costs.
Absolutely. So now's the time for people to ask their questions, and we do have one question, so please ask some questions. So we have a question from someone. Any advice on, is it molluscum?
Molluscum,
How do you
yes.
say it?
Molluscum contagion.
Molluscum.
Yes.
And the best way to treat this?
Yes. So first of all, molluscum is so common in children. And molluscum, Katrina, is a little pox virus of the skin.
Okay.
And says a little raised little papule with a tiny little, what we call a little pedunculated center. So it looks like a tiny little mini volcano. They are so common. Most children will have them, and they spread via skin-skin contact. So when children are playing at school, they will be prone to getting molluscum. Unfortunately, we don't have lots of good treatments for molluscum. It's obviously the main thing is trying to prevent them, trying to avoid it. In some children, we can potentially use a freezing treatment, so a little bit of cryotherapy or liquid nitrogen, but that can have side effects and isn't tolerated in younger children. So sadly, we don't have lots of good treatment for molluscum, but to reassure parents, they are benign, whilst they are a nuisance to have on the skin, and they have a certain lifespan, and then they will go away after that.
And you said the best thing to do is to prevent getting it. So how would you prevent?
So again, just making sure, obviously, if one sibling or one child in the family has one or two little molluscum, to make sure that, you're using separate flannels for washing, separate, those types of practical things.
Yeah.
Molluscum is actually much more common on skin that is dry or skin that is prone to eczema, because like we've already discussed, that skin barrier isn't as good. So the little pox virus can get into the skin much more easily. So again, making sure you moisturize the skin in order to keep that skin barrier good to prevent any of those infections.
And as we seem to have a dire lack of questions, which is very uncommon, you've been let off the hook. What's the most common questions that you get asked?
So I suppose as far as, eczema goes, a lot of it just reassuring people, that we do see this and this will improve. And also, those practical tips about how you apply creams, when you apply them, that whole education, and just reassurance and support and guidance with regards to using topical steroid, how much, how often, how long for, is important in children. And then again, thinking about some of those other things that we see, the birthmarks, the little vascular stains, the little hemangiomas, again, just reassuring parents, that these are benign and nothing to worry about. So a lot of it is just that reassurance, that education.
When you see people with birthmarks, especially on the face, when you see the strawberry marks, I think do they call them strawberry marks?
There are different types. The little strawberry marks are the little raised areas. Obviously, you can get things like a port wine stain, which is much more.
Yes. I mean, do they advise to, obviously they don't go away, or I think the strawberry ones, they might fade, but it's definitely the prominent ones. Do people remove them generally, or?
All very dependent on the size, location, not as young children. No, that would be more, sometimes a little bit of laser can be helpful, but that is, child is a little bit older.
Okay. So I'm just having a check that we have covered what we have said we were going to cover, and I was going to sort of wrap up by saying what you said is, first of all, don't worry if your child does have eczema. There's a very good chance it's going to disappear. And I think also one of the things that I've learned from people that have, they're more scarred mentally by the child, whereas the child grows out of it and forgets the child had such a horrendous experience with it. It's the parent that's left with the experience of it, isn't it?
Absolutely.
And to make sure that you apply and go and see the doctor if you're at all concerned, or speak to your midwife or whatever. Apply cream generously,
regularly.
regularly. Don't be frightened about using steroids as long as you use them responsibly, sensibly, and the way that you've been told to use them.
As advised, absolutely.
And you don't carry on using them. That's the big deal, is you don't carry on using them.
Exactly. Yes.
And don't get that one that you used last year out of the cupboard and put on again. That is not the idea.
That's good. That is not good.
No, not good. And then the other thing that I've also learned is that it's really important that when you think of the problem has gone, you still carry on treating it, but maybe with a milder version, which is your management side of
exactly.
it.
Preventative treatment is so important.
What else have we learned? Those are the main things, really. And keep going back to the doctor if you're not happy.
Exactly.
They won't like that, will they?
But they're all great and everyone tries their best. So
yes. And if you are concerned, then presumably as you can ask your GP to be referred to a consultant like yourself.
Yes, exactly. If things are not settling, getting worse despite treatment, there's any concern about, is diagnosis or, is this correct or management is difficult, absolutely, referral for secondary care and hopefully, gain a little bit more advice there.
Just as we're wrapping up, we've certainly had some questions. So would you mind if I quickly ask them to you? Would that be all right, Jennifer? So I just want to know, is there some sort of therapy system for eczema, like radiotherapy or something similar?
No, we do not use radiotherapy for treatment of eczema. Sometimes topical treatments aren't improving and eczema is very severe. Sometimes we have to use a tablet treatment. It is an immunosuppressant tablet, so lots of blood monitoring, does have some side effects, but we do not use radiotherapy for.
No. Okay. What are the most common triggers for eczema in babies? Is it dairy products or what else?
Again, allergy is a whole other. I don't really want to go into allergy because every child is different, and that's a whole other topic. Dairy, cow's milk protein definitely can act as can be a trigger, can for babies be a trigger as far as true allergy goes, but there can be other foodstuffs that can cause or potentially cause eczema flaring with food allergy. But again, so important if you think that is occurring to see your GP and get referred like we've discussed.
Okay. And last one, any advice when the skin looks clear, i.e. no visible eczema, but my son's still experiencing intense itching?
So again, like I say, you think I'm very boring. Moisturize. So even if there's no signs of any active eczema, there's no signs of any inflammation, so topical steroid isn't needed because they're obviously anti-inflammatory. If the skin is a little bit dry, you can get a little bit of subclinical inflammation, a bit of dryness, so just make sure the skin barrier is as intact as you can and just lots and lots of moisturizer.
Right. Brilliant. Right then, I think that's it. So I'm sorry for everyone that might have had a few problems getting on to the clinic, but I'm ready now for grandchildren. Actually, I won't say that too loud, but I'm ready now for babies.
Oh.
Anyway, thank you so much, Jennifer, and thank you everyone for joining us. Bye.
No. Bye.